Many of us think that flat foot is a problem. Actually, it is not so. Almost 40 to 47% of the population have some kind of a flat foot, and many a times this helps in their walking, this helps in their balance. Flat foot is a problem only when there are aches and pains that we see in your feet or some kind of a deformity that we see in your feet. Otherwise, you can always live with a flat foot wearing appropriate footwear. Foot health is most often ignored, and there are several misconceptions and myths around it. I'll be addressing some of the myths and telling some of the facts about the foot today. All of us sometime or the other have had an ankle sprain or a twisted ankle. And when we have an ankle sprain, usually we do some home remedies and it's back into walking, back into running. But for most of us, that is not so. There are repeated ankle sprains or ankle twists that keep happening, and that would injure our tendons and ligaments. If you are someone who is having a repeated ankle sprains or ankle twists, you should visit the nearest doctor to check about your ankle stability and not ignore those ankle sprains and doing home remedies. We all have seen in the cinema halls and have heard that smoking causes cancer, oral cancers, lung cancers, and it has nothing to do with the feet. But no, smoking causes smokers gangrene in the feet, which can lead to amputation of the toes or amputation of the lower limb itself. Ensure you give up on your smoking if you have to run, if you have to walk. Can a man fit into a woman's shoes, or can a woman fit into a man's shoes? We usually don't recommend that you wear a men's shoes or a man wear a woman's shoes. The feet are structurally different between a man and a woman. The heel width is more in a man, and which is much lesser in women. The arch height is more in women and lesser in men. And also the forefoot is broader in women and not so broad in men. So considering these structural differences that happens by birth, there is a different sizing for women and there is a different sizing for men. And it is important to ensure that the footwear is chosen correctly before you get into walking or running. When we are born with a flat feet, and it generally by the age of 19, it will come into a normal feet. Most of us are not born with any genetic deformity of the feet. There are only a few numbers who has genetic deformity. But all the foot issues, that is 300 plus foot issues that we get, are majorly due to our lifestyle, the kind of footwear that we wear, or the kind of walking that we do, or the kind of running that we do. Most of those ailments of the foot can be prevented early on by the right way of walking, by wearing the right shoes and doing the right things for the feet. If you have any more questions about the myths and misconceptions, please comment so that I can respond to you. If you want to know more about foot health, please like and subscribe to the channel and share it with your friends.